Are you dizzy? You are not alone. Approximately half of the American population aged 65 and over experience falls. Half of these individuals who fall do so repeatedly. Injuries associated with falls are the sixth leading cause of death among the elderly population. In 2001, more than 1.6 million seniors were treated in the emergency room for fall-related injuries. This number continues to grow. Of those who fall, 20 to 30% suffer moderate to severe injuries, such as hip fractures or head trauma. Among older adults, there are 360,000 to 480,000 fall-related fractures each year. The total direct cost of fall injuries for people 65 and older in 2000 was slightly more than $19 billion, with over $179 million of that being for fatal falls. By the year 2020, the annual direct and indirect cost of fall injuries is expected to reach $43.8 billion. The average individual cost to repair fall-sustained fractures is $26,912. Direct costs do not account for the long-term effects of these injuries, such as disability, dependence on others, lost time from work or household duties, reduced quality of life. Psychological trauma and fear of falling cause self-imposed activity reduction, resulting in decreased strength, flexibility, and mobility. As a result, you will have a further increased risk of future falls. To determine your risk of falling, you will be screened by a licensed physical therapist and audiologist that specialize in disorders of the balance system. The screening will last approximately 20 minutes. The results of your screening do not indicate that you will or will not fall, only the likelihood of falling. This is the functional reach test. It is designed to show the examiner how far you can bend at the waist and reach while maintaining your balance. This is a subtest of the Tinetti Mobility Test. It is designed to show the examiner if you are able to maintain your balance while sitting and then standing without the use of your arms. This is the gait with vertical head turns. This task is designed to show the examiner if you are able to look up and down while walking with no change in gait or imbalance. This task is designed to show the examiner if you are able to maintain your balance with a narrow stance and your eyes closed. This task may be made more challenging by adding a small push to really test your abilities. This task is designed to show the examiner if you are able to step over a small obstacle without changing gait speed and showing no evidence of imbalance. After the screening, you will receive a determination for further intervention with recommendations to take to your physician. Likely recommendations may include vestibular therapy or video nystagmography testing. If you would like to schedule an appointment, please contact the ASU Speech and Hearing Clinic at 480-965-2373. You can also email shhclinic@asu.edu. If you are in the office, you can speak with Stephanie Valencia at the front desk of the clinic. What is a VNG test? VNG stands for video nystagmography. It is a test used to evaluate vertigo, dizziness, and imbalance. There are three parts to the test: oculomotor, positioning and positional, and calorics. The majority of the test will require you to sit or lay down. For the entirety of the test, you will be wearing video goggles so the clinician can monitor your eye movements. The appointment for a VNG assessment lasts approximately 1.5 hours. The first part of the VNG is the ocular motor. You will be asked to follow a red dot across a light bar. The light will move in various directions and the clinician will provide you with instructions for each individual exercise. These tests are used to evaluate the connections between your eyes and vestibular system. The second part of the VNG test is the positional and positioning. During this portion of the test, the clinician will ask you to move into different positions so they can view any eye movements that occur in each position. This portion of the test also involves the Dix-Hallpike test, which is a test used to diagnose BPPV, or benign paroxysmal positional vertigo. This test allows the clinician to see through your eye movements if the small crystals, otoconia, may be suspended in the fluid of your inner ear, sending false signals to your brain that you are dizzy. The third and final part of the VNG test is the calorics. This portion of the test is used to identify which ear is causing the feeling of dizziness or to find out that it may be caused by both. The calorics test involves the clinician putting warm and cool water or air in your ears for approximately 1 minute to stimulate your inner ear. Before arriving for your scheduled VNG test, do not wear any facial makeup including mascara, eyeliner, or facial creams. Medications can greatly influence the test results. For 48 hours prior to your test, do not take any of the following medications as they will affect the test results. Vital medications should not be stopped. Continue to take medications for heart, blood pressure, thyroid, anticoagulants, birth control, antidepressants, and diabetes. If you are unsure about discontinuing a particular medication, please call your physician to determine if it is medically safe for you to be without them for 48 hours. If it is a morning test, do not eat breakfast. If your test is in the afternoon, please do not eat within 4 hours of the test in order to avoid nausea. Avoid caffeinated beverages prior to the test. Alcohol should be avoided within 48 hours of the test.